We're now at an era where there's a significant paradigm shift, a change in what is considered the standard of care for breast reconstruction. It used to be the case that an implant-based breast reconstruction was performed beneath the pectoralis major muscle. The pectoralis major muscle is one of the major muscles within our chest. And in the past, in order to perform a breast reconstruction for a woman, that muscle had to be separated from the other muscles, cut into, elevated, so that the materials for the breast reconstruction could be inserted beneath them. But nowadays, there's been a shift towards pre-pectoral breast reconstruction. In no way do I mean that the other method, a subpectoral breast reconstruction, is no longer the standard of care or is acceptable. And in many cases, it provides a very good breast reconstruction. But for most of my patients, I'm using the pre-pectoral breast reconstruction because I believe it has several advantages in comparison to the subpectoral breast reconstruction method. First, I just want to describe what a pre-pectoral breast reconstruction is. A pre-pectoral breast reconstruction is where, instead of elevating the pectoralis major muscle and cutting into it in order to do that elevation, it's left in its anatomic place on the chest wall, and the breast is built on top of that muscle underneath the skin that is left behind after the mastectomy. A tissue expander is wrapped in an acellular dermal matrix collagen sheet and is placed on top of those chest tissues with the breast skin resting on top of it. And then in a secondary procedure, usually about 4 to 5 months later, after the skin has healed and it has been given a chance to rest, the tissue expander is removed and the implant is placed in its place. When that is done, the implant itself is resting on top of the pectoralis major muscle, and on top of the implant is the patient's own skin, and between the patient's own skin and the implant is an acellular dermal matrix sheet, a collagen sheet that is a cadaveric collagen sheet that has come from someone who's passed away and has given some of their tissue. In fact, it's the dermis or the collagen that exists underneath our skin. They've given that to be able to help women who are undergoing breast reconstruction. In a separate segment, I will address why that is used. The reason that I believe that pre-pectoral breast reconstruction is favorable in comparison to subpectoral breast reconstruction for most patients is that it has some advantages. The advantages are the following. One, most patients find that that it causes less discomfort. Or better said, patients who have undergone this type of breast reconstruction report less immediate postoperative pain and less long-term discomfort in their chest in comparison to the patients who in the past had the subpectoral breast reconstruction. The reason for this should seem somewhat obvious in that in the subpectoral breast reconstruction method, we had to elevate and cut into that muscle. That in and of itself is creating more incision within the body, and cutting into muscles is generally more uncomfortable than just working with the skin and the tissues beneath the skin. In addition to that, the difference in the long-term discomfort with the subpectoral method causing generally more discomfort in the long term than the pre-pectoral method has to do with the fact that in the subpectoral method, the pectoralis major muscle is on top of the implant, and whenever someone moves their arm, it's squeezing down on the implant, which is not necessarily a natural or normal function of the muscle, and that in patients tends to cause a tightness or a discomfort that we just don't hear as often in patients who are undergoing the pre-pectoral method. The reason for that, in the pre-pectoral method, the muscle is no longer squeezing on top of an implant, and so the muscle can function in a more natural way when someone's moving their arms to do activities of daily living or sporting activities.